Maternal and newborn care at the Pumwani Maternity Hospital here in Nairobi County has received a major boost of health equipment worth 2 million shillings from the Aga Khan University's Center of Excellence in Women and Child Health, East Africa. The handover of the equipment comes following the recently concluded COVID-19 in pregnancy study. Our very own Grace Ahati has more.
Maternity hospital's capacity to provide comprehensive essential maternity and newborn care, the facility has received health equipment worth 2 million shillings from the Aga Khan University's Center of Excellence in Women and Child Health East Africa. The equipment, which includes an ultrasound machine, have been handed over to the facility following a recently concluded COVID-19 in pregnancy study, which sought to determine if severe acute respiratory syndrome coronavirus 2 infection during pregnancy increases the risk of adverse pregnancy, perinatal, neonatal and postpartum outcomes by collecting data from women infected with the disease. Speaking during the handover ceremony, Nairobi County Chief Officer for Health Facilities Management, Geoffrey Mosiria, hailed the move, noting that it is complementing the government's goal of universal healthcare for all Kenyans by 2030, which includes the scaling up of maternal and child health.
Research is what helps us improve the quality of care in this facility. These equipments, we used to refer mothers across the road. People say that we don't have an ultrasound. We are referring, at night we are referring across the road. And some were saying we are doing business. We had to introduce a sonographer at night on a locum. And now with this one, I know sometimes even mothers, they don't pay because with free maternity, sometimes we lose a lot of revenue.
According to the study, pregnant women are among vulnerable groups susceptible to respiratory infections, placing them at a high risk of contracting COVID-19, which can lead to severe illness, creating a need for intensive care unit admission and ventilator requirement. The director of the Aga Khan University's Center of Excellence in Women and Child Health East Africa, Marlene Temerman, has thus noted that the study will help to develop recommendations on surveillance, management, and counseling of women during and after pregnancy, as well as their babies in the context of a pandemic.
But this particular program indeed started in 2020. So I'm very happy that today we will be able to hand over. Today is actually the closure of the active phase of the program. Data collection, etc. So it's ending this month. The results are not analyzed yet because we have to wait for all the countries.